Good afternoon, Dr. Priest.
How are you?
Great. Thank you for joining us today.
Sure, let me turn my volume up a little bit.
We will get started in just a couple of minutes.
Okay. Previously, when we do these, I used to give kind of an opening statement. Are we going to go right to questions, or what do you want to do?
Now, we'll have you introduce yourself and your title. You can give opening statements, and then I'll open it up to media and also have questions as well.
Okay. It's been a while since we did one of these. I don't know how many hundreds we did over the last 3.5 years, but I feel like I'm out of practice.
I was going to say 3 years in, it's wild to be talking about another variant, but people are interested. We've gotten quite a few inquiries about it. So thank you for making time in your schedule for us.
Sure.
All right. Well, it is the top of the hour, so we will go ahead and get started. If you'd like to introduce yourself, have some opening comments, and then we'll go straight to questions.
Sure. I can't remember who else used to be on this call. I used to do it every single week for years, but thanks for joining today. I'm David Priest. I'm an infectious diseases physician. I'm the chief safety and quality officer at Novant. I'll give you just a few comments about where we are and respiratory viruses, and then take any questions that you might have. What we're seeing in our hospitals is some increase in the number of patients we're admitting to the hospital with COVID. It's not a major increase, but we're seeing some increasing amounts of cases. You may all have friends or family who recently have had COVID. And so we just see a little bit more of it in our communities. I noted that the North Carolina website has shown that there's increasing amounts of COVID in our wastewater. So that speaks to increasing amounts of COVID really in our communities. Most common variant we see now is EG5, which is the Eris variant. You may have seen that in the media lately as well. This is a descendant of Omicron, like most of these XBB variants that are around now. So between 3 different XBB variants and EG5, that's about half the variants that are out there fall into that category, and they're all somewhat related. I think we'll see a little bit of a bump as we go through the summer here. We've had that in the previous summers during the pandemic. That's not new, but I do not think this is a major surge. We'll see what happens in the fall. And the reasons I don't think it's a major surge is we have pretty widespread immunity in our communities, at least to some degree. Almost everybody has been vaccinated or had COVID or both, and that's pretty protective. I think the increase in cases now is really related to waning immunity. If it's been a while since you had a vaccine dose or been a while since you had COVID, you're just a little more vulnerable. You're a little more likely to have a case, but not very likely to have real severe illness unless you have some chronic medical problems. So I think that's really part of the issue here. People are traveling, amazing amounts of travel this summer. People are staying inside in air-conditioned areas with people because of the heat around the country. And so I think that's just provided an environment where COVID can spread. And so I think that's what we're seeing. I think in the fall, we may see something different. We have a lot of respiratory viruses that spread in the fall, and I think this fall will be no different. Between COVID and influenza and respiratory syncytial virus, or RSV, and a host of other viruses, we'll see those kind of throughout the fall. The really great news is we have emerging new tools to help protect people from those viruses. So next month, we're anticipating a new COVID booster that will be geared toward one of the XBB variants. That's one of the dominant variants in our communities right now. We don't know what the recommendation is as to who would get that booster. I suspect at minimum it'll be older individuals and those with chronic medical problems. Who will be most likely that it'd be recommended they get that new COVID booster. We don't have word on that just yet. We, of course, have our influenza vaccines that we've had for many years that are available. And then also very exciting is new tools to treat or to prevent RSV. So vaccines for adults and new monoclonal antibodies for infants is really exciting. Years ago, we used to think of RSV as a disease of small children and infants. And if you've had an infant or a small child with RSV, it can be quite frightening. Children are more vulnerable. Their immune systems are not as mature. Their lungs are smaller, and thousands of children are hospitalized every year with RSV. In more recent years, with better diagnostic tools, we also realize that RSV can be a real threat for older people. And so we notice in our hospitals, we have people admitted to our ICUs every winter who are adults who have had RSV. So there are new vaccines that are coming. Some already been approved for adults, a treatment to prevent kids from getting it, and some other vaccines are coming. So the first time in a very long time, we'll have those tools. So really good news as it pertains to respiratory viruses in the fall and our ability to protect ourselves from those. One question posed to me is the Eris variant of COVID presenting in a different way than Omicron? And so far, we have not seen any evidence that Eris is a more serious infection or doing anything different. We tend to not see the whole taste and smell thing we saw earlier in the pandemic with the earlier versions of COVID, but certainly high fevers and respiratory illness and cough, some sinus congestion have been part of Eris. And as that continues, we'll have a better idea of what we're seeing. But often it's hard to distinguish COVID variants based on symptoms. The other thing the question has been posed to me is, what about masking and the role of masking? I don't anticipate we'll see the call for widespread community masking unless we have a variant come through that we just don't have immunity to. I do think masking is an important tool that we'll use more strategically than maybe before when there was so much COVID and not much immunity, and we recommended masking in a variety of settings. And what I mean by that is, I think people with chronic illnesses who are older, who are going to be in areas where they could get COVID, might consider masking, particularly cancer patients and those with diabetes or chronic respiratory issues. I think in hospitals, we may have times during the respiratory virus season that we mask in particular units, or even mask in a whole hospital if we're having a large amount of respiratory illness. So I think masking as a more streamlined strategic tool is still something we would utilize in those settings, and then we'll see how it goes from there. So with that, I will take any questions that you have.
Yeah, Dr. Priest, one that we have received is regarding testing. It feels like as we shift COVID to more of a seasonal issue, what are now the guidelines for testing? Because with RSV and flu, like you mentioned, some of these symptoms are really widely similar. When should somebody go get COVID tested?
Yeah, it's a really good question. I think there's the question of that's not quite settled. What do we do about testing now? And then what test do you use? And do you trust the one that you have? So we still have our home kits. I think we've all learned that they're not as reliable as some of the PCR testing that we have available. So I think it depends we've said this many times over the 3 years, a little calculus equation you have to do to figure this out in your own life. Who have I been around? What's the likelihood I could have COVID? I think some of the general principles are, if you're sick, it's best to stay home from work and school. That's just regardless of whether you had the flu or RSV or rhinovirus or COVID, be considerate and stay home. I think if you are concerned that you could have COVID or you want to know, you can use a home kit, but I'd probably do more than one test over a couple of days because they don't seem to be as reliable as some of the PCR testing. Or if you want to get an answer, you can go get a PCR test going forward. But I think this is the transition we're making from COVID being the pandemic that it's been into kind of it being endemic in the community and one of many circulating viruses. So I would encourage people to be respectful of others when they're ill and then proceed that way.
That's great. And as we prepare for back to school season, are you seeing children's cases on the rise as well in terms of spreading those germs that we always anticipate additional sicknesses with the back to school scene? Are you advising parents of the same?
Yeah, so we haven't seen a big increase in children's cases certainly this summer, and I think to your point, as children get back into school, that could occur with COVID and many other viruses. So it's best when kids are sick to keep them home, and I know that's a challenge for working parents and all the things that go into that logistically. But I think it's a good idea to try to keep kids from school if they have fever, certainly.
Great. I'll turn it over, and any of the media that's in attendance, if you have questions for Dr. Priest, feel free to speak up, or if you'd prefer to drop them in the chat, I'm happy to moderate.
Dr. Priest, I'll go ahead and ask a question while people are still thinking. And maybe this is a little early, but I know you talked about the booster and that people with pre-existing conditions or who are older, which is probably 60 plus, depending. But there's a lot of people out there who may want to get a booster just because they want all the protection they can get. Do we think that will that still be covered by insurers or the government now that the pandemic is over, or is it too early to answer that? Because I know a lot of people who aren't necessarily older, but they'll take every COVID shot they can get their hands on.
Yeah, without a doubt. And I think there'll be enough wiggle room in the next guideline for the new booster that others younger than age 60 could probably still get it. I think they'll focus on older adults and then kind of give enough guidance on that. So I think most of the time that's going to be covered. But it remains to be seen. We'll have to see. And I get a lot of questions, hey doc, I'm due for a bivalent booster. I could get that last one. Should I wait a month till this new thing comes out? And in general, otherwise healthy people, I think, can wait. If you're somebody with severe immune system issues, you might consider going ahead and getting that second bivalent booster. But I think most of the patients who ask me that, who are otherwise healthy, have had some doses of vaccine, have had COVID, I don't think they're getting much benefit from a bivalent booster. They're going to want to get the new one in September, where, geared toward more recent variants.
Great. We have a question in the chat from Kenneth with WFAE. He'd like to know what the current COVID numbers are in North Carolina, if you can speak to that.
Yeah, what I can tell you is we've kind of moved to following kind of the percentage of influenza-like illness that comes to the emergency department or COVID-like illness that comes to the emergency department, and wastewater monitoring. I think it's more accurate to the question, to the question posed earlier about testing. People just aren't being tested in the same way. And so we have to think about how many patients do we have in the hospital, what percentage of patients are coming to the emergency department with these kind of illnesses, and how much COVID's in the wastewater. And so right now, I think the emergency department influenza-like illness rate's about 3.8%, which is pretty stable the last few weeks. Hospitalizations are up a little bit, and the amount of COVID and wastewater is up. So again, not to really high levels, just a little bit higher than it had been. We've been quite low over certain parts of the summer. So I think the way we measure COVID activity is changing. It's less about numbers of cases, and it's more about percentage that are ill or making up ED visits or taking up hospital beds, and that kind of thing is more how we're measuring now.
Great. And another question in the chat: have quarantine recommendations for testing positive changed at all, and do you anticipate that they will?
They haven't. I mean, they've still been sticking with this 5-day number, I think, for some time now, as long as you're improving and those kind of things. That can be a little bit different if you have problems with your immune system. Recommendations are a little bit different. So you ought to talk to your doctor about that, and just be smart if you obviously continue to have fever or still quite ill about potentially exposing other people.
Great. Are there any additional questions? Oh, WFAE has a follow-up. Kenneth, we actually asked that before you joined about going back to school and what parents should know. I'll send out this recording once we wrap up, and that answer will be in there as well.
Awesome. Thank you. I guess I can also ask this, if I may have missed it, forgive me, but did you guys also ask a question about some of the current best practices to stay safe from it?
Yeah, so I would say those haven't changed a lot. I think if individuals are sick, no matter what they have, culturally we ought to work on staying home from work and school. And sometimes that's easier said than done, right? So if you have a job that you already work from home, you don't have children, it's a little bit easier. And we have logistics of getting kids to school and all those kind of things can be somewhat harder. But certainly with people with respiratory illness and fever should stay home from work or school. We talked about masking earlier a little bit. I don't think you're going to see much in the way of calls for broad community-wide masking we're at this point in the pandemic, but I do think there's some strategic areas where masking can be beneficial for people, certainly on public transport. We didn't talk about that earlier, but on airplanes, If you're older, you have chronic immune system issues, if you know you're in the middle of a big respiratory virus season, I think to make it more socially acceptable for people who need to be able to mask, I think we'll strategically mask often in hospitals and maybe in cancer units or emergency departments or even whole hospitals if we have a whole bunch of respiratory virus activity. So I think, I remember, I don't totally remember this, but not that long ago in medicine, people in healthcare didn't wear gloves like they do now. And sometimes people said, why are you putting on gloves? You think there's something wrong with me? Why would you put on gloves? And as hand hygiene came into focus and those kind of things, now the opposite has occurred, right? We actually say, why are you not wearing gloves? So the public kind of expectation around healthcare is that healthcare workers wear gloves, where it used to be the opposite. The public was concerned they were wearing gloves. And I think masking is somewhat of the same thing. Why are you wearing a mask? Where in many cultures around the world, masking is, even before the pandemic, was widely accepted socially. And so I think hopefully we'll have some shift in our society where people will accept that there are instances where wearing a mask is an appropriate thing to do and allow people to do that.
That's great, Dr. Priest. Thank you. Are there any additional questions?
I promise this will be the last follow-up, but I might have missed it as well. About boosters. I'm not sure if you also had that discussion about boosters coming up here in the fall.
Yeah, we did. So there'll be a booster that comes out in September, probably geared toward XBB, one of the Omicron variants. It'll be a single, just have one variant within that booster or geared toward one variant. We don't know yet what the recommendation is as to who gets that booster, but we're expecting to know something, in the next 4 or 6 weeks, something like that.
Thank you.
Dr. Priest, my name is
Well, as
Anne-Marie.
mentioned, I will send
Hey, hold on. Anne-Marie had a question there, Caroline.
I'm so sorry. I didn't realize. I'm with Healthy Headlines, and I just listening, and obviously you don't have a crystal ball going into fall into winter, but where do you see this variant kind of going? Do you think it's just kind of like we're not really have to worry about it all that much? We're not going to have the hospitals filling, or is it kind of like as we go into winter, we don't really know what's going to happen?
Yeah, I think this particular variant is just the natural progression of Omicron. So I don't think this is the one that's going to, have a devastating impact on our communities. I think people who have not had COVID in a while or been vaccinated a while will probably get COVID, and they'll have respiratory illness and fever and feel lousy for a few days, and then most people will do fine with it. I think the concern is always the variant that's not similar to Omicron. A variant that totally eludes kind of the immunity we've collectively built. We just have to hope that doesn't come. If that doesn't come, I think, COVID may not be the dominant virus as we go throughout the winter. We'll have RSV, we'll have flu, we'll have rhinovirus, all the other viruses that we're all exposed to, other types of coronaviruses. So I don't think this particular variant is the one that's going to be a major issue. COVID has not become truly seasonal like influenza yet. There is influenza actually in the summer, but no one tests for it, and there's not a lot of it. So we think of it as being very seasonal. Late November through March kind of is the flu season. COVID is still kind of rearing its head at other points throughout the year. And hopefully we'll move toward more of a seasonality, and perhaps it'll be a seasonality in the fall and winter, or perhaps we're just going to have these kind of up and down little peaks all the time. Rhinovirus, the virus that causes the common cold, is kind of a year-round thing. And so we just don't quite know where COVID's going to go in that. But I think if it stays as it is, we'll have enough immunity or rotating immunity through our communities, or I should say rolling immunity throughout our communities, that most people will do quite well. It's just watching for that variant that none of us has any protection to.
That was great. Thank you very much. I appreciate it.
Great. Dr. Priest, thank you so much for your time this afternoon and continuing to educate us on all things COVID and other viruses. Like I mentioned, we'll send out the recording of this later today. And thank you all so much for attending. Thanks, Dr. Priest.
Thanks, everybody.
Bye.